Hello, good evening, friends. Welcome to the Vital Pulp Therapy Series Part 3. Previously, in Part 1 and Part 2, we have discussed the theory and the concept behind the two types of pulpotomies, that is, partial pulpotomy and full pulpotomy, and a very related concept and the treatment management, the management protocol of a slightly related but different clinical situation we are going to do today. So let us see today's MCQ and discuss the theory behind it. All right. So a 16-year-old presents with a complicated crown fracture of upper right canine 3 days after the traumatic injury. Now the choice of treatment in this case would be, all right. So let us again look at the key points here. We have number one, a 16-year-old patient. What does that mean? What clue does that give? That we are in a situation where we are dealing with a canine, that is a tooth, with full or complete maturation of the root. So if I'm taking the sagittal or the proximal view of this tooth, let us say this is the labial surface, right? And the root of the canine, it is complete. This is our most important point here. So let us just highlight this area. The root and maturation has completely taken place. All right. Now the fracture is complicated. So let us see that. There is exposure of the pulp. So there's exposure of the pulp. There's a complicated crown fracture. The pulp is exposed. The next important point. The next important point is that 3 days or more than 3 days have elapsed. More than or equal to 3 days have elapsed. So now it is understood that the inflammation in the pulp chamber has gone pretty deep. It's not restricted to the superficial 2 to 3 millimeters of the pulp in the pulp chamber. So we can do two things. One is we can do a full pulpotomy or a cervical pulpotomy in which we remove the entire pulp with the help of, say, a round burr or an endodontic spoon excavator to the level of the CJ or the canal orifice. Okay. Do we do that, or we do a pulpectomy in this situation? Here, because the root end formation has completely taken place, so there is no big advantage of any pulp preserving procedure, that is pulpotomy, right? There is no serious or any big advantage in retaining the pulp, in retaining the formative capacity of the pulp, because the root end maturation has already taken place. So why to complicate things further? Simply go for a good, pulpectomy and do a nice root canal treatment and keep the tooth on follow-up. And hopefully the tooth will serve the patient for many, many years. In fact, it is said that if the root canal treatment, especially in this situation, in which the pulp, is still vital, right? The pulp is still vital or about to be necrotic, right? And you do a nice root canal treatment, then you can actually, this kind of a tooth with a mature apex without the pulp and a nice obturation can actually serve an entire lifetime of the patient. So the best answer here would be pulpectomy. Okay. So this brings us to the end of today's discussion. Wishing you all the very best. Thank you.